Welcome back. The CDC is no longer collecting reports on COVID-19 vaccine side effects through its V-Safe page. Millions of Americans reported impacts from the vaccine, so what's going on? To find out, we spoke with Dr. Peter McCullough, the author of The Courage to Face COVID-19. Dr. Peter McCullough, thank you so much for joining us.
Thanks for having me.
It seems the CDC has quietly removed a page that was for collecting COVID adverse effects. And it seems when there's a new medicine coming out, normally there's a lot of data collection. So after 2 years, is it still necessary to be collecting this type of data?
It is. The CDC V-Safe data is the CDC's program that's on the cell phones. It's the one opportunity for patients themselves to report side effects they're having with the new vaccines. With each one of the new COVID vaccines, it's a brand new formula producing a brand new sets of spike proteins that the human body hasn't seen before. And we can expect potentially new side effects or amplified problems that have already known to be occurring with the vaccines. So it's very important that the CDC continue to collect safety data. This action, to me, means they're turning a blind eye towards safety.
And on that note, is there any place to collect that data right now?
You know, as we sit here today, the CDC still has the VAERS system. The VAERS system, you know, the vast majority are entered by doctors, nurses, paramedics, and others. It's not a patient-friendly system to do the entries. In fact, you have to have all the doctor's information to enter in VAERS. And then outside of that, we have some NGOs that have reporting mechanisms, including the Truth for Health Foundation. But I can tell you right now, the CDC has no reason to shut down V-Safe. That is their system for patient-reported safety.
And Doctor, speaking of new vaccines or new variants, President Biden on Friday asked Congress for more funding to create a new vaccine or a booster, at least for the new variants. Apparently, the ones currently out don't really help on that. So how is there going to be data collection on this new one?
You know, the current boosters were outdated before they hit the market. They were called BA4, BA5 boosters. So they didn't work. People got COVID anyway. Now, the companies are still behind the virus. So the companies will have an XBB 1.5 vaccine, but XBB 1.5 now, as of mid-August, is less than 5% of the strains and going away. The current strain is Eris or an EG5. So right now, it's a hopeless endeavor to keep chasing this rapidly mutating virus. The vaccines are far too late, and all they're doing is making patients sick because they have side effects. None of the vaccines appear to be any safer than the original ones.
And on that note, some people could be on their 5th, 6th, or potentially even 7th booster. Is there any precedent for so many shots in such a short time in history?
No, there's no precedent for taking 7 booster shots or 7 shots even total. If someone's following the government narrative, they're taking 7 shots. No, we've had no public figure, no president, vice president, any senator, any public health official state publicly that they've taken 7 shots. So, I think if people really are supporting this program, we should understand who really has taken 7 shots and who has quietly fallen away from taking them because of safety concerns.
And just really quickly, I want your advice on how do we tell the difference between a therapeutic and a sterilizing vaccine? Because it seems these have been recommended or even mandated. That's normally reserved for sterilizing. So what is that fundamental difference?
Sterilizing vaccines mean that once somebody has the vaccine on board, that it basically sterilizes or neutralizes the pathogen. And so, one can't get it and one can't give it to someone else. Our CDC told us early in 2021 the vaccines were not sterilizing. In fact, fully vaccinated people were giving the virus to fully vaccinated people. So that left, the only issue of whether or not it has any therapeutic benefits. Do they reduce the risk of hospitalization and death? And the answer is no. And the consent form, FAQ, doesn't make that claim. So the official government documents that patients see do not make the claim that the vaccines reduce hospitalization and death, yet public health agencies and others out there are pushing a false narrative that the vaccines make the illness less severe when indeed it doesn't.
Wow. Dr. Peter McCullough, thank you so much for your time.
Thank you.